Hi, I'm Andrew from Sleep Right Australia. I'm here with Dr David Cunnington at Sleep Right Australia in Wangaratta, and today we are making some videos to talk about the services we provide. So David, why do we do home-based sleep studies?
So home-based sleep study is a perfect way of trying to work out if someone has bad sleep apnea or not. So the ideal person for a home-based sleep study is somewhere where the health professional thinks they might be at risk of having significant sleep apnea, and a really efficient way of being able to confirm that diagnosis and rule in that diagnosis. Not really suitable for someone with very complex medical conditions, particularly cardiac conditions or respiratory conditions. And often we're concerned that someone may not be able to set themselves up at home, but you solve that problem.
Yeah, we do, and we don't find it that difficult to go out to the home and fit those devices. It can be quite stressful for patients to have to fit themselves. So yeah, for us to be able to do that takes away a lot of the stress and gives us more accurate data. So
Yeah.
How does a lab-based study differ from a home-based study?
Well, actually the variables we measure are pretty similar with a home-based and laboratory-based study, but I can control things a lot better with a laboratory study because technicians are there overnight. If something comes off, that can be readjusted, and electrically things are a lot cleaner. At home there's often electrical interference which can make the signals a bit noisier. During a laboratory-based study I can also do video if I need to for particular sleep conditions, and if I'm adjusting somebody's CPAP machine I can also adjust the pressures remotely and measure airflow with a CPAP machine on, something I can't do as readily with a home-based sleep study.
When would you choose to do a lab-based study in front of a home-based sleep study?
Part of it comes down to personal preference and part of it comes down to the question I'm trying to answer. A lot of people prefer to have a sleep test done at home rather than the strange environment of a laboratory. They find it more convenient, they find it less intimidating, and so a lot of people do choose that. There will be though times when medically I do need that extra monitoring that I can get in a laboratory, and that's when I'll recommend to somebody they do come to a laboratory. But if it's mainly sleep apnea and I'm trying to get that diagnosis, then a home study will give that answer.
What information do we get from a home-based sleep study?
So a home-based sleep study allows us to determine how much someone's actually slept and how frequently there are troubles with breathing, either the airway partially narrowing or blocking completely. And from that we can calculate how many times per hour they have trouble with breathing, and we call that the apnea-hypopnea index. We then use that to determine the severity of sleep apnea. If that's more than 30 times per hour we call that severe. If it's 15 to 30 we call it moderate, or less than 15 we'll call that mild sleep apnea.
And how is this information useful?
So it's really helpful to know the severity of sleep apnea when planning treatment. So people with severe sleep apnea, so that apnea-hypopnea index more than 30, that is associated with both risk of accidents as well as increased cardiovascular risk. So when I'm thinking about managing them, I actually want to manage those risks, even if they don't have a lot in the way of symptoms. Whereas if people have mild to moderate sleep apnea, I'm much more focused on symptoms. It also helps me in terms of choosing treatments. So some treatments like CPAP, for example, work much better at the severe end of the spectrum, and other treatments like dental appliances can work a bit better at the mild to moderate end of the spectrum.
Following on from that, what can't you tell from a sleep study?
So a sleep study doesn't replace a consultation. So sure, I can measure how often someone has trouble with breathing during sleep or how long they've slept, but I can't tell why someone might be tired, or I can't tell what might be disturbing them during the night, because that really involves talking to somebody and taking a clinical assessment. So if I take a clinical assessment and pair that with a sleep study, that's what helps me to answer those questions. Sleep studies are great for answering that question about how bad is my sleep apnea, do I have it, how bad is it, but not necessarily why am I tired.